Hello and welcome to the top stories of this week's IACM Bulletin. Europe's Citizens' Initiative for the Improvement of Access to the Medical Use of Cannabis. The European Commission agreed to register a multinational initiative to foster access to the medical use of cannabis and promote research into the therapeutic potential of the plant. That means signature gathering can get underway. Petitioners will have 6 months to start the drive, then must gather 1 million signatures from at least 7 member countries within a year to force the European Union to consider the proposal. 2 studies report on the benefits of cannabis for sleep disorders. According to an analysis of data from 61 patients with insomnia included in the UK Medical Cannabis Registry, cannabis improved their sleep quality. A second report comes from the USA. 30 days of daily data on sleep quality and cannabis use were collected in 347 individuals who use cannabis for mild to moderate anxiety. This was a study by the University of Colorado in Boulder. Participants self-reported both the form of cannabis and the ratio of THC to CBD in the cannabis used. Respondents who used cannabis edibles with high CBD concentrations reported the highest perceived quality of sleep. Ukraine. President signs medical cannabis law. Ukrainian President Volodymyr Zelensky signed into law a bill that was adopted by Parliament on 21 December 2023. It would come into force 6 months after it is officially published. Uruguay. Sales of cannabis in pharmacies doubled in 2023. During 2023, about 3.3 tons of cannabis were sold in pharmacies, according to data from the Institute for the Regulation and Control of Cannabis. This figure represents an all-time high and is almost double the 1.8 tons of legal cannabis sold in 2022. CBD induces programmed cell death in colorectal cancer cells. CBD induces apoptosis, a form of programmed cell death, and autophagy in colorectal cancer cells. Cannabinoids may inhibit the production of amyloid beta in patients with Alzheimer's disease. The plant cannabinoids CBC, cannabichromane, CBG, cannabidiol, and CBN, cannabinol, significantly inhibit amyloid beta evoked toxicity to nerve cells and changes in nerve cell morphology. Amyloid beta is a substance produced in Alzheimer's disease and is toxic to nerve cells. Endocannabinoids exhibit anxiolytic effects. An increase of endocannabinoids by inhibition of their degradation reduced anxiety in mice. Authors concluded that their results of the study suggest the feasibility of targeting the endocannabinoid system for the treatment of various mental disorders. CBD exerts anti-inflammatory effects in inflammation of the brain induced by a high-fat diet. In a study with rats receiving a high-fat diet, the administration of CBD caused anti-inflammatory effects in early stages of brain inflammation. This can raise hopes for the future use of the cannabinoid for therapeutic purposes, since it is a substance lacking lasting and severe side effects, authors wrote. Bone formation may be inhibited or stimulated by CBD or CBD and THC. In studies with osteoblasts, cells that produce bone mineral, THC and CBD dose-dependently inhibited or stimulated bone cells. Authors noted that potential unfavorable effects of cannabinoids on bone cells and bone health is a complex matter. Cannabis use has no effect on caries development. Using data of a large group of patients, researchers found that there was no significant association between marijuana smoking and dental caries experience. However, the combination with tobacco had some negative effects. These were the top stories of the IACM Bulletin. Thank you for your interest.